So in America, we love complaining about our healthcare system. Of course it has problems because every healthcare system has problems, but almost everyone who says they'd prefer healthcare like Europe or Canada is usually more focused on the fake it's free stuff and less focused on the downsides, like lower quality care, huge waiting times, no accountability for doctors, and far less access to cutting edge services and drugs. Would you rather get the best care and treatment and drugs while complaining about insurance, or die on a waiting list for an MRI in Canada, which is eventually free?
Today on How is Canadian Healthcare, I need an MRI to see if I have a brain tumor. And go ahead, guess when it is. Go ahead, guess. It's in 2026. 2026. My MRI to see if I have a brain tumor is in 2026.
So a big part of the problem here is that politicians love to dilute really complicated problems down to one bad guy they can just use as a scapegoat. Big pharma greed is to blame, or insurance company greed is to blame, or hospital greed is to blame. Throw in an executive order promising to lower drug prices, and you got a pretty perfect storm of Fantasyland. Don't forget, though, they do this with everything. Remember when greedy independent grocery stores were responsible for inflation? Yeah, no. For the millionth time, yes, the American healthcare system has problems, but it's still the best in the world. And why? Well, because free markets still play a role. Do I wish they played a bigger role? Yes, of course, but the good stuff in our healthcare system isn't because of government control. If it was, Obamacare would have lowered your costs. But it goes beyond the parts of our healthcare system we all know about. Pharmacy benefit managers, or PBMs, are a more subtle example of the same scapegoating you get when people just lash out at big pharma or hospitals or insurance companies, even though PBMs are still a part of the fight for free markets. Sometimes they're the only part. If you actually care about real innovation and cost control through competition, the stuff Republicans used to care about, you need to understand PBMs. Again, are they perfect? No. But if we actually care about keeping a shred of free market influence in our system, PBMs are one of the few things holding the line. And now they're under attack by the FTC, by politicians, and by some pretty one-sided media coverage. So in basic terms, pharmacy benefit managers are the negotiators you've probably never heard of. But they're also the reason drug prices don't bankrupt every employer in America. PBMs negotiate with drug companies to lower prices for health plans, employers, unions, and ultimately all of us, all without new regulations that don't work, government price boards that don't work, or handouts that don't work. So for example, a couple of weeks ago, CVS and Novo Nordisk agreed to sell their GLP-1 drug Wegovy at a cheaper price for tens of millions of insured patients. So what does it mean? More patient access to Wegovy, and even uninsured patients will see a discounted cash price just by walking into their local CVS, but don't worry, you'll still get that 3-foot-long receipt. And what does this mean for folks on the other GLP-1s? Not much. If they want to stay on their current drug, they can. This was just a negotiated discount. Just private companies competing and delivering results in a win for the free market and for patients. There are a bunch of headlines flying around right now saying that the FTC is going after PBMs, and they released a report claiming PBMs are overcharging, engaging in anti-competitive behavior, and hurting independent pharmacies. But as usual, there's way more to the story. So first off, the FTC based its findings on just 51 specialty generic drugs. That's less than 2% of total drug spending. They cherry-picked a tiny, unrepresentative slice of the market and called it proof of industry-wide abuse, and ignored the thousands of other drugs PBMs manage every single day, with the whole picture showing that PBMs save money for employers, patients, and the healthcare system. Oh, and those markups the FTC reported? They ignored PBM operating costs and focused on percentage markups for super low-cost drugs, which wildly distorts the numbers. In reality, PBMs are working with margins under 10%, which is way lower than drug manufacturers, wholesalers, or even retail pharmacies. And when you look at all drugs, not just the cherry-picked 2%, the average markup for PBM-affiliated pharmacies is actually negative. That means, on the whole, PBMs provide a net discount across the market. Recent analysis even shows these discounts added up to $15.9 billion, more than double the supposed markups the FTC is complaining about. And what about the claim that PBMs are putting independent pharmacies out of business? The data doesn't support that either. Non-affiliated pharmacies still hold over 58% of the market share, and that share has grown in recent years. In other words, competition is alive, well, and working. What's going on here is more of the same routine of picking a bad guy and pretending like they're the one roadblock to utopia, while ignoring that PBMs are actually cutting into the profits of some pretty powerful players who don't want the spotlight on them. It's easier to do business if you don't have to negotiate prices. So what do you think happens if you get rid of PBMs? Again, PBMs aren't perfect because no system is. But if we actually want a future where healthcare is affordable and innovative, where choice matters and patients still have power, unlike anywhere else in the world, by the way, then we need pharmacy benefit managers. If the FTC and Congress actually care about reality, which is a big if, maybe they should start listening to all of the data, not just the parts that give part of the picture. If we tear down PBMs without understanding what they actually do, prices are only going to go one way, and that's up. And who will pay the price? We will. So whenever someone tells you that less competition and more government is the solution, maybe ask yourself if they actually have your best interest in mind, because I promise you, they don't.